Hi, I'm Taren Grom, editor of PharmaVOICE, at the Copay Summit in Alexandria, Virginia. In this Editor's Take video, I meet with Paul LeVine, representing Mango Health, a TrialCard company. Let's get to the conversation. Paul, welcome to the PharmaVOICE Editor's Take video program.
Thank you, it's a pleasure.
And welcome to the World Congress Copay Summit.
Appreciate it, it's been a great summit so far.
Excellent. Let's talk about some of the important issues you've been discussing during this conference today. Why are copay programs such an important component to a brand's overall marketing and engagement and RM strategy?
Well, copay programs have this reputation as being extremely good at doing one thing, which is reducing the barriers to access for an individual getting a product. And it does that great, but it can do so much more. And one of the focal points for us has been, how do we leverage copay and affordability programs to achieve a whole slew of other challenges that the industry faces? So I look at copay programs and think that they're the fulcrum, they're sort of the place on which you can balance a number of different programs to try to address different needs, such as improving primary non-adherence, secondary adherence, real-world evidence. All of these become possible through the avenues and auspices of copay programs.
And real-world evidence is becoming such a hot topic right now. It's not that it hasn't had attention in the past, but it's really starting to gain some altitude. And how is that going to impact what you all are doing?
Well, real-world evidence programs has been a real focal point for me over my career for quite some time. And for us, one of the pieces that we felt we needed to really improve upon and expand upon was our ability to leverage the scale of copay programs to be able to create programs and real-world evidence and patient-reported outcomes approaches that can address larger numbers of patients. It's very, very difficult as one-off efforts to try to do these programs. Copay is an incredible acquisition tool. So if you use it with that in mind, there are many other things that you can really achieve, and real-world evidence is one of them.
Excellent. So once patients are enrolled into these programs, what's actually possible? And then as a follow-up, what types of engagements can pharma manufacturers actually provide?
So the first and I would say most important thing for any patient who gets involved in a program such as this is that you will have your copay card embedded within the application. Once that's there, that patient never has to worry about, do I have the card with me? If I go to a different pharmacy and they don't have it on record, how do I know where it is? It's always on your mobile phone. So I think that's one of the key pieces of it. The next part of it that I think is really an important attribute is the ability to help with that adherence challenge. So when patients need to get a refill, there's a way that we'll be able to alert them that they're coming up to the point where they should be going to the pharmacy and being able to fill that script in order to stay on therapy. So that should help out a tremendous amount as well. And I would say that the third major area is really that this application and this approach becomes the vehicle through which manufacturers can now start having a conversation with their patients.
What action would you want a pharma manufacturer to take as they kick off their 2020 copay programs?
Oh, goodness gracious. I think that's, from my perspective, that's easy. It's saying a copay program and an adherence program and many other aspects of what you're trying to do with patients in support of a brand can all be achieved using the centerpiece of a copay program. As I've said before, and I feel like I'm almost repeating myself way too much, but I feel so strongly about it because the ability to acquire patients into this program that people really want and really need is tremendous. So if we start thinking about it as not just serving this one small piece, small but important, but not this one small piece, but is in fact the centerpiece of all your outreach activities, it changes the game. And that's how I really want them to think about it.
That's wonderful insights, and thank you for sharing them with us. On the manufacturer side, who's involved in the decision making in terms of linking their brand to your product?
Well, this is one of the interesting issues, because if you think about pharma, and this is probably a little bit more of the case on a big pharma side, you have people on access and affordability thinking about, how do I get hub programs and copay programs effective for my patients? And you've got the engagement and adherence people who are also thinking about those kinds of issues themselves. But rarely do those two groups meet in the middle. So the adherence and engagement people think about creating one-off solutions that try to address those issues. They're good solutions. One of the fascinating things about looking at adherence in general as an issue is that it's not like we're lacking on interventions that work. The problem is you never get enough quantity, enough volume of patients in order to move the needle. That's why bringing the access and affordability people together with those adherence and engagement people, that's how you start to really supercharge these types of programs.
It goes back to your original analogy about the fulcrum and balancing the competing forces.
Exactly right. Exactly right.
Thank you so much for being part of our Editors Take Video program.
My pleasure. Thank you so much, and good to see you.
Good to see you as well.
Okay.
Thank you for watching this Editors Take video. For more information about Mango Health, visit www.mangohealth.com and check out our other Editors Take videos at pharmavoice.com/videos.